The coronavirus. It's spread beyond China.
We have confirmed the first case of Wuhan novel coronavirus patient in Singapore.
Cases have been confirmed across Asia, in the US, and today in France. It's not been designated a pandemic, and it's uncertain whether it has the potential to become one. Yet health experts stress that the scale of the pandemic threat is potentially catastrophic.
It has not yet become a global health emergency. It may yet become one.
A new strain of disease develops. Few, if any, people have immunity. Airborne human-to-human infection enables rapid progress through a population. Globalized travel and urban living puts rocket boosters under its spread. So how well prepared is the world to cope with a pandemic? Scares over SARS in 2003, bird flu in 2006 and swine flu in 2009, and also Ebola and Zika in recent years, have focused policymakers' minds on the need for pandemic preparation. The World Health Organization has established a global influenza surveillance network covering 105 countries as a planetary alert mechanism. But it's one thing knowing what the right procedures are, it's another thing ensuring that they are carried out. Last year, a group called the Global Preparedness Monitoring Board, convened by the WHO and the World Bank, warned of major gaps in our pandemic preparedness. It cited a lack of long-term, holistic, costed resource mobilisation plans. It said that not a single country's preparedness plan had been fully funded. Further, it warned that the WHO itself was underfunded, hindering its ability to provide a global safety net.
I'm Ramy Inocencio in Beijing. In the ground zero city of Wuhan, an army of excavators is in a frantic race to build a hospital in the next 10 days, with 1,000 beds for those sickened by the virus. As patients continue to pack hospitals, medical supplies are running low. Public transportation has been suspended. Toll plazas have become security checkpoints.
Fear seems infectious throughout the country, including the capital, Beijing.
If this were any other Chinese New Year, this park would be crowded with people celebrating the holiday. But coronavirus panic is keeping most people at home.
That includes tourists. Shanghai Disneyland has been shut down, parts of the Great Wall too. Officials took the extraordinary step of restricting travel in 11 cities, putting 35 million people on lockdown, almost the population of Canada.
And we've just learned about 3 brand new confirmed cases in France. Those are the very first coronaviruses in all of Europe, and the country's health minister says they expect more to follow. Nora?
All right, Ramy, thank you.
He may well look glum. This is a bad time for China. 26 deaths so far from the novel coronavirus and at least 830 infected. And an unprecedented quarantine. Wuhan and central China and nearby cities in lockdown, not a soul to be seen. Except here, like an art installation, the Dance of the Diggers, purportedly a building site for a hospital, the authorities say will be ready in 6 days. The new strain, not previously identified in humans, is causing alarm, though the World Health Organization says it's too early to declare an international public health emergency.
At the beginning of any outbreak, you would focus more on the severe cases, and you will have more of those, and then maybe we are missing some mild cases because people will just be a little bit sick.
Today, the Lancet Medical Journal published preliminary data from Wuhan, saying the virus appears to cause similar symptoms to SARS, also a coronavirus, which killed 800 and infected 8,000 in 2002-03. The similar symptoms are fever, dry cough and shortness of breath, but not, and this is what makes it different, a runny nose, sneezing, sore throat or diarrhea. The source of the initial infection of this coronavirus is still not known, but the working theory is that it's from animals sold in the Wuhan fish market. The virus has then transferred to humans and then between people, breathed in and damaging the respiratory system with no treatment. The most important health message is wash your hands.
On the eve of Chinese New Year, Asia is grappling with a growing health crisis. China has stepped up quarantine efforts to contain the Wuhan coronavirus. Travel restrictions have been imposed on more than a dozen cities on the mainland, affecting around 40 million people. The death toll has climbed to 26, with new cases reported in Singapore, Vietnam, and Japan. The travel ban has already locked down 11 million people in Wuhan, which is ground zero for the virus. Railway stations are mostly shut, flights have been suspended, and major roads closed. That's now been expanded to include at least 10 other cities in Hubei province, and that includes Jingzhou, with a population of 6.4 million people. And in Huangshi, transport routes have also been shut down. A ferry terminal and bridge over the Yangtze River have been closed. Away from Hubei province, Beijing has closed the Forbidden City. It will also close some sections of the Great Wall, while Shanghai Disneyland will close tomorrow indefinitely. This at a time when the theme park is usually packed with tourists. Last year, it was sold out during Chinese New Year. China has now reported almost 900 cases of the virus, and all but 2 of China's 31 provinces and municipalities are now affected. The World Health Organization has stopped short of declaring the outbreak as an international emergency, saying it's still too early, but it has declared it an emergency in China itself. All this, as you might expect, has dampened the mood on the eve of Chinese New Year.
Is standing by for us in Hong Kong. Afifa, there are reports that Wuhan doctors are finding new symptoms of the virus. What do we know?
Well, yes, Don, according to some local reports by the Chinese media, there are a few healthcare officials in Wuhan who have found several cases of infected patients who did not display the commonly recognized early symptoms, so things like fever and cough. They had cited a case of a 45-year-old man who only displayed symptoms of diarrhea and had no fever or any respiratory problems. But after a few tests were being conducted, it was indeed found that he was infected with the virus. So healthcare officials in Wuhan are urging the public and doctors to look out for a wider range of possible early symptoms, and this includes nausea, dizziness, conjunctivitis, and even muscle soreness. And so they are worried, of course, because of the larger possibilities of early symptoms, that it will be a challenge for medical professionals to really identify or diagnose if a person is indeed a suspected case of infection of the virus. And they also are worried that members of the public will take a delay or a longer time to identify any of these early symptoms.
This morning, the CDC announced confirmation of the second case of novel coronavirus in the U.S. and the first in Illinois. The patient is a Chicago resident, and my team at the Chicago Department of Public Health is working in close coordination with the CDC, the Illinois Department of Public Health, the Cook County Department of Public Health, and many other partners at the local, state, and national level to ensure a coordinated response. I particularly want to thank Mayor Lightfoot and her office, who have been in constant communication and fully engaged in supporting our collaborative efforts to keep the public safe and informed. I will tell you some more about the patient in a minute, but I want to start by stating clearly that this is a single travel-associated case, not a local emergency. We obviously take emerging viruses very seriously, and there are still many unanswered questions about this novel virus. But I can reassure you that even with this Chicago case, the health risk to the general public from novel coronavirus remains low at this time, both nationally and in Chicago. Chicago has been building its public health preparedness systems for years, and we have a solid response plan in place. There is no need for the general public to change their behavior in any way based on this news. The patient is a woman in her 60s. Most importantly, I'm pleased to report that she is clinically doing well and is in stable condition. She traveled to Wuhan, China in late December and returned to the U.S. on January 13th. A few days after arriving home, the patient began to feel unwell. She called ahead to alert her doctor to her illness, rather than just presenting to a clinic or emergency department. This is exactly what any potentially ill returning traveler from Wuhan should do: call ahead and seek medical care. This patient's doctor's office appropriately asked about travel history and quickly put a mask on the patient, helping limit the potential risk of spreading infection. Her doctor then referred her directly to a hospital with infection control capabilities for further workup. Again, this is exactly what we've been educating local healthcare providers to do. Ask about travel history and reach out to your local public health department to discuss any ill patients with recent travel to Wuhan, China. Hospital staff then placed her in the appropriate setting for infection control, performed a full clinical workup, including ruling out more common viruses like influenza, and worked with public health to arrange testing for novel coronavirus at CDC. The patient is clinically doing well. She is currently in stable condition and remains hospitalized primarily for infection control. While we will be following her course closely, the patient's story so far highlights the way public health messaging and awareness are working locally, as well as the importance of coordination and awareness in the clinical setting. The patient has been very helpful as we've been gathering information about her contacts in recent days. She was not symptomatic when flying. And based on what we know now about this virus, our concern for transmission before symptoms develop is low, so that is reassuring. She has limited close contacts, all of whom are currently well and who will be monitored closely for symptoms. We will also be monitoring the healthcare workers who have cared for and continue to care for this patient. Since returning from China, the patient has had very limited movement outside her home. Now that this test is positive, we will continue to collect and confirm even more information about her activities and contacts. But we know already, for example, that she has not taken public transportation. She has not attended any large gatherings. And actually, to our best knowledge at this point, she has not had extended close contact with anyone outside her home since returning from China and prior to admission to the healthcare system. So this is all very reassuring in terms of infection risk to the general public, which again remains low nationally and locally. Anytime a new virus emerges, we are reminded of how small our world is and of how critical it is to invest in building strong public health systems. I want to thank the federal, state, and many local partners who have worked together and prepared, not just to respond to this case, but over many years to ensure the Chicago area is well prepared to respond to emerging infectious diseases.
We do have a second confirmed case of the coronavirus in this country. Let's get to Meg Tirrell. Meg?
Carl, the CDC is confirming a second patient who had traveled to Wuhan, China, has been confirmed with the novel coronavirus. She is a woman in her 60s, a resident of Chicago. She returned to the country on January 13th, and the CDC says she traveled before she was symptomatic. They say the risk to the general public nationally and in Chicago is low. They say currently she's clinically doing well and she's in stable condition. She's in isolation in the hospital primarily for reasons of concern about spread. They are tracing her contacts. They say generally since she returned, she did not have much close contact outside of her home. So they are reiterating again, they think that the immediate risk to the U.S. public is low at this time. Of course, the first case has been confirmed in Washington State a couple days ago. That patient we have heard is also doing well. Public health officials say this is evolving. They do expect to see potentially more travel-related cases or cases passed between humans here in the U.S. They urge people to be vigilant if they've traveled to that part of the world. However, right now, saying the immediate risk to the U.S. population is low. We'll bring you more, Carl. Back to you.